all parents with small children. Be careful where you keep supplemental or medical gummies. It comes as emergency rooms are seeing more kids overdosing from melatonin, THC, and CBD gummies because kids believe they're normal gummies that they can eat. CBS 12's Katie Benti has everything parents need to know tonight. Katie?
They may look like candy and taste like candy, but these gummies are not the type anyone should be eating by the handful. Experts say it's actually those similarities that have so many kids accidentally gobbling too many. And while in some cases the side effects can be mild, other times it can be fatal. Colorful, sweet, and tasty, but these gummies are not candy.
Not a day goes by where I don't get a call about a child that's gotten into one of these gummy products.
Florida's Poison Control Center medical director, Dr. Jeffrey Bernstein, says he's been seeing more kids coming into the ER overdosing on melatonin and CBD gummies. The most serious cases typically involving THC gummies.
Some of whom need help breathing, and so you have to put a tube into their airway and put them on a ventilator for a little while until they wake up.
Dr. Wendy Stefan works as an epidemiologist and educator with the center. She says part of the problem is how these products are packaged.
With the THC, the really potent cannabis-derived medications, in our state, they're not required to be individually packaged. So you do, in fact, see, whole containers or open bottles where a child could potentially get a lot.
Bernstein says kids often mistake these medical gummies for a sweet treat.
Who can eat just one gummy bear, right?
And that's exactly why so many end up eating more than their body can handle.
You're supposed to just eat the ear, or just eat one, an arm or a leg, or just, a quarter of it, or eat an eighth of it. Nobody does that. And unless you read the instructions carefully, you're not going to know that. And so that's responsible for a lot of the overdoses that we see.
Some of the most common symptoms to look out for are nausea, extreme lethargy, and confusion. The center is urging parents who have these products in the house, make sure they're being kept out of reach for children. It can be as simple as a cabinet lock or something more durable.
This is a medicine lock bag, which actually has a lock with a key. This is a portable one, so good for travel, right? And then if you have several people taking a lot of medicine, there is sort of the full-on medicine lock box, or even a hard-sided metal safe.
Better to be safe than sorry. If you think your child may have eaten too many gummies, or maybe they're acting strange or unusual, you can call Poison Control. Their services are free and confidential. We'll have that number on our website, cbs12.com.
The unexpected death of U.S. Olympic sprinter Tori Bowie is putting a spotlight on a pregnancy complication that is more likely to impact Black women. You may remember Bowie, who was 8 months pregnant and in labor, died unexpectedly last month in her Orange County home. An autopsy report from the medical examiner's office in Orlando was just released, and it shows Bowie's possible complications included eclampsia. Danny Travis found out that it is a very common health complication for pregnant Black women seen locally that doctors now want to raise awareness about. She joins us live in studio with more. Danny?
Yes, Sam. Well, it's important to first understand what this condition is that's unique to pregnancy. Now, preeclampsia starts with high blood pressure, eventually developing to eclampsia when high blood pressure leads to seizures if not treated properly. While health officials say any demographic of pregnant women can suffer from this condition, Black women are much more likely to develop it. In fact, Dr. Melanie Altizer, the chief of obstetrics at St. Mary's Medical Center in West Palm Beach, says Black women are 3 to 4 times more likely to die from this pregnancy-related complication as opposed to the white patient population. Dr. Altizer says at St. Mary's they serve a large Black and Hispanic population. She says they see multiple cases of preeclampsia weekly, if not daily. While she says the condition is very common, very rarely does it result in death if it's caught early and treated properly. But Dr. Altizer says there's several reasons why doctors believe there's a disparity.
Black women suffer more chronic conditions, and we think that some of that may be related to access to health care and systemic and implicit biases that we can sometimes see in our healthcare system. And so there's been a big push recently, particularly from the obstetrical world, to try to mitigate and eliminate these biases. So much about work.
Dr. Altizer says access to care and education on the condition needs to improve for the underserved and pregnant Black patient population. She wants to educate pregnant patients on the early maternal warning signs of a potential problem. This includes severe headaches that don't resolve with Tylenol, visual disturbances, severe pain under the right rib cage, severe indigestion, and extreme swelling in the hands and feet. Now, the earlier warning signs can be identified, the earlier pregnant patients can receive help. Dr. Altizer says if any emergency happens in the middle of the night and your healthcare provider isn't open, the OB/GYN emergency department at the hospital is open 24/7.